In the world of mental health and therapy, there are a number of different professional titles which can be confusing if you're either looking for support or thinking about training in the future. So in this video, I'll be explaining the key differences between a counsellor, a psychotherapist, a psychologist, and a psychiatrist. While they all focus on supporting psychological health and emotional well-being, there are some very clear differences in terms of the scope of their training and practice. Starting with counselling and psychotherapy, the three core roles are mapped out in the UK at least, using something called the SCOPED framework. SCOPED stands for Scope of Practice and Education, and the framework was produced in collaboration with the major UK regulatory bodies, including UKCP and BACP, with the aim of bringing more consistency and clarity to what different practitioners are trained to do. The three core roles defined in the framework are counsellor, psychotherapeutic counsellor, and psychotherapist. These roles all share a foundation in relational, ethical, and reflective therapeutic work, but they differ in terms of the depth of training, the types of issues they address, and the length of time they typically spend working with clients. A counsellor is someone who generally works with people on a short-term basis to help them cope with and navigate specific issues and emotional difficulties that they're experiencing in the present day. These might include things like stress, anxiety, or low mood. The therapeutic relationship in this context is often supportive and non-directive, giving clients a space to talk through their feelings, gain clarity, and develop practical strategies for coping with the challenges that they're encountering. While the focus tends to be on present-day struggles, the counselling relationship can still be very deep and nurturing, providing that vital source of emotional support and connection for the client. The key difference here, though, is that counsellors typically don't delve back into deep past experiences unless the client brings them up in the course of therapy. The work is more about helping clients get back on track and regain emotional stability with a clear and present focus. Training to become a qualified counsellor in the UK typically takes 2 years. Next, let's move on to the psychotherapeutic counsellor. This role sits between the counsellor and the psychotherapist in terms of the depth of training and the types of issues addressed. A psychotherapeutic counsellor has usually completed 3 or more years of training, which includes working with both current issues and more complex emotional patterns. While they still support clients through immediate emotional difficulties, they may also begin to explore how past experiences, including childhood trauma or early attachment, may be affecting the way a client thinks, feels, and behaves in the present. The key difference between psychotherapeutic counselling and regular counselling is that a psychotherapeutic counsellor will often focus on both short-term relief and long-term emotional growth. This role tends to engage more with the underlying causes of distress, which may include long-standing emotional wounds or unconscious emotional patterns. While psychotherapeutic counsellors focus on the therapeutic relationship, they are also trained in and may integrate a more varied set of therapeutic techniques and approaches to help clients process their feelings and experiences. This work can often take months or even years, depending on the depth of the issues involved. Finally, we come to the psychotherapist. A psychotherapist typically undertakes 4 or more years of training, making this the most advanced level of therapeutic education in the SCOPED framework. Psychotherapists are trained to work with more complex and entrenched emotional issues, often rooted in deep past experiences or long-standing emotional patterns. Psychotherapy is typically long-term. This could mean weekly sessions over a period of months or even years, depending on the nature of the work being done. The therapeutic relationship in psychotherapy is particularly central, serving as the vehicle through which healing takes place. The connection between therapist and client is seen as a powerful space for working through difficult emotions, and the psychotherapist will often help the client see how early experiences or unconscious dynamics are playing out in the present. One visual metaphor I have found helpful as a way of understanding the difference between a counsellor, a psychotherapeutic counsellor, and a psychotherapist is to imagine your emotional life and your inner world as being like a garden. A counsellor is like a groundskeeper. They help maintain the garden by clearing space and managing areas that have become overgrown, restoring balance to your emotional life when things feel out of control. Psychotherapeutic counsellor is more like a gardener. They dig deeper into the emotional soil, working with past experiences that affect the present and guiding you to uncover hidden emotional patterns. A psychotherapist is like a landscape architect. They focus on redesigning the garden's foundations, working with deeper, long-term emotional issues to bring about personal transformation and lasting change. So each role brings something very important, but with a different depth of engagement. Now, it's important to note that while more training can provide therapists with greater skills and knowledge, higher levels of training do not always equate to a better therapeutic experience. First of all, relational skills are often more important than the length of a therapist's training. A counsellor who is warm, empathetic, and skilled in building trust can offer just as much, if not more, value than a psychotherapist who has years of experience, but who is lacking strong relational skills. Second is the importance importance of the therapeutic fit. This is about how well the therapist's approach resonates with your needs and personality, the rapport that exists between you, and the extent to which you like, trust, and respect each other. You may well find that a therapist with less formal training feels more comfortable and effective for you, and that's a really good and important sign. The third thing is that experience matters. Someone who has spent years working in real-world settings will likely have a much deeper understanding of how to work effectively with people than someone who is newly qualified, regardless of their level of training. When it comes to psychologists and psychiatrists, their training focuses on different areas altogether. Psychologists, unlike the previous roles, come from an academic background. They follow a different training pathway that focuses on understanding human behaviour from a research-based perspective. They typically complete a 3-year undergraduate degree in psychology before an additional 3 years of advanced doctoral level training to qualify either as a clinical psychologist or as a counselling psychologist. A clinical psychologist focuses on the assessment and treatment of a wide variety of mental health conditions, including more complex mental health issues such as personality disorders and psychosis. Clinical psychologists often use evidence-based interventions such as CBT, cognitive behavioural therapy, and DBT, dialectical behavioural therapy, but they are also trained in the art of psychological assessment. They might work as part of multidisciplinary teams in settings like hospitals, mental health clinics, and private practices. Counselling psychologists integrate a wider range of therapeutic approaches, drawing from evidence-based therapies and relational work. The focus of counselling psychology is on the person as a whole. Counselling psychologists tend to work with clients across their lifespan, addressing a wide range of emotional and psychological issues. They blend psychological theory with practical therapeutic interventions, often working in NHS settings, private practice, or in community services. Finally, we have the psychiatrist. A psychiatrist is a medical doctor who is specialised in mental health. Their role is rooted in medicine, so they can diagnose mental health conditions, prescribe medication, and offer medical oversight when it comes to treating mental health issues, particularly those that are severe or complex. Psychiatry is a diverse field with specialisations such as child and adolescent psychiatry, neuropsychiatry, and forensic psychiatry. Some psychiatrists focus on medication management and medical diagnosis, while others may also provide psychotherapy. The training to become a psychiatrist is by far the most extensive: 5 years of a medical degree followed by 2 years of general medical training as a junior doctor, followed by a further 6 years of specialty training in psychiatry to become a consultant psychiatrist. So I hope this has given you a sense of clarity around the differences between these professions. While they do differ in terms of the depth of training and the scope of practice, they do all share the common focus of promoting psychological health and emotional well-being. That's all for today's video. Thank you for watching. If you have any comments or questions, please leave them below and I'll be sure to reply. Subscribe for more content like this, and I'll see you next time.